the presentation. Again, thank you everyone for joining us for Suicide Awareness and Prevention. Today we have Debbie Del Rosario with us, and she's a licensed clinical social worker with 25 years of clinical experience in both direct and managed care environments. And we are very lucky to have her. She's the Director of Behavioral Health Clinical Programs at Florida Blue. And just one thing, there are a couple of slides you might want to see larger than you can see them right now. And if you go to the square at the top right of where the PowerPoint is and click on it, you can go full screen. Okay, and with that, I'm going to turn the microphone over to Debbie.
Hi, good afternoon, everybody. Thank you so much for spending your time today with us and having this opportunity to talk about something that's very important. Being aware of ways and opportunities that we can prevent suicide and being able to help those who are in pain. So, this is September is Suicide Awareness Month, and definitely wanted to bring forward and have a discussion with everybody talking about the public health impact of suicide, looking at some risk factors and warning signs that individuals may exhibit, how we can help somebody with suicidal thoughts, and then some great resources to help link individuals with services to help them get through those hard and difficult times. So it's definitely thanks for this opportunity to be with us at this moment. Our first thing is definitely looking at suicide is not just the numbers. It is something that impacts one family and could just, due to the one individual hurting themselves or hurting that family that they're out there. We found in 2020 that the suicide rates was the 10th leading cause of death overall. And that's over 46,000 members or people in the United States being impacted. This is actually a slightly, I think it doesn't feel that way, but it is a slightly better result than where we were in 2019. At that time, there was about 47,000 individuals who committed suicide in 2019. So we are seeing some changes. We're seeing some improvements from some capacities, but it's still, anytime we have a loss such as this, it is definitely one that is so impactful. It is found that this suicide is the 9th leading cause of death for people between the ages of 35 and 64. And it definitely impacts our youth. It's looking at the 3rd cause of death in individuals who are 10 to 24. And even when you bring that age group even lower, it's the 2nd cause of death for individuals from the 10 to 14 years of age. Like I mentioned, the rate has been more than 46,000 individuals out there who have committed, who died by suicide. And then for every death, there are multiple attempts that usually call out during that time. And it has been, for this last year, we've found that individuals have experienced at least 27 different suicide attempts that have caused that and or have led up until that time. It's not it's rarely a single circumstance or event. There are many risk factors that may lead to an individual who believes this is their way of getting through their pain. We have found that some of the different components, and this again maybe a slide to hopefully increase as well, is that there is a number of factors that can place in there, whether it's by community, looking at the individual, societal reasons, or your own individual relationship with others. So when looking at individuals on a community standpoint, that when there is the lack of health care, the lack of ability to access that health care and reaching out for that hope, reaching out for somebody who can help you with that areas, there is a potential increase of risk. If there is in the community, there's high violence, or if there's discrimination for individuals to receive care. When we look at the individual person, there could be capacities or risk factors such as, does this person have a history of depression? Have they had previous suicide attempts? As I mentioned just recent, or the previous indication, there's multiple attempts that usually may occur prior to. If there is a misuse of substances, there could be an increase of alcohol or drug utilization during these times as they are trying to cope through their pain and numbing it with the substance misuse. Traditionally, these individuals may feel a sense of hopelessness, that they are not able to get through anything and feeling a downward spiral. They may be going through some criminal legal issues or may have some job or financial problems or loss that they may feel, again, the overwhelming negative circumstances that are currently occurring with them. When people are going through these issues, they may look for ways of help to get through, and they may not seek out help during this time from a societal standpoint. There may be stigma in seeking help or even being potentially identified with a mental illness. They feel that they may not be able to ask for help because they don't want to be labeled as such. They might not seek the services that they need. If individuals have easy access to maybe lethal means of suicide, maybe another risk that they have, or if there's an unsafe or media portrayal of suicide that maybe thinks that it is the way to get through. When we look at the social or the relationships that a person may have, some of the other impacts may be social isolation. They may have a family history of suicide. They may have lost maybe a certain relationship. Maybe it was going through a separation, a divorce, a death of a loved one during that time. Or they may be feeling bullying, that they are feeling that their peers or others are impacting them negatively in that way. And they're feeling their self-esteem is a lot lower during that time frame. So a combination of these different capacities or circumstances may impact and cause a risk of potential suicide. When looking at, and suicide is a very serious health problem. It has long-lasting impacts. It impacts an individual. It impacts the family. It impacts the community. And finding a way, or the only positive that I can think of is that actually suicide is preventable, that there are strategies that we can put into place and really to find ways of preventing this at all levels. We have to kind of address it from all different perspectives, just like it was the risk factors are impacting in all different ways. The ways that we can prevent this is also from a societal standpoint. We look at ways that everybody can step in and do that, and some of them could include, learning about the warning signs as you all are being part of this presentation at this time, finding ways of identifying when somebody is heading down that dark path and finding ways of helping promote being aware of it, helping find ways of preventing it, and looking at how we can help those individuals who are going through this hard pain where they feel that there is no other way to get out of it, helping them build their resiliency and how to commit to a more positive coping mechanisms are very essential components that we can have in there. Some wonderful ways that we can help prevent, or some strategies that can be put into place, is looking how to strengthen access and delivery of suicide care. So that could be including making sure, from, again, a societal standpoint, that health coverages includes not just medical side, but mental health. Making sure that is a component, as we believe that there's no health without mental health, that's a piece of taking care of somebody, is making sure mental health services are available for them. It's making sure that the access is available. So if you are in a time of crisis, that you may be in an underserved area, how can we bridge that gap? How can we make sure that there is linkage to a member or to a provider to help so you can reach out for that help and that care that you need? When it's looking at the suicide care, making sure that the treatment facilities that are in place are delivering a very more appropriate helping those individuals who are going through the suicide. When we're looking at promoting connectedness, that is another component where we are trying to normalize that we may feel down, we may feel at a loss, but you have a peer support available. So building up our connection with one another will definitely get us through those times, and building up community engagement, that it's not to be ashamed that somebody's going through pain or loss, and that we're here to help. Because it's addressing this hopelessness. Once individuals go through that spiral, they feel that there is no way to get out. They feel that hopelessness just heavy on them. And a way of getting through is looking at ways to how can we teach how to cope? How can we help them get through those times, and building some problem solving, because it's when they feel that there is no wall, or there's a wall there that they can't get through. that they think that's a solution. So it's definitely building up and addressing the hopeless capacities, teaching ways of getting through it. A last one here is definitely identifying and supporting those people at risk. It's looking at ways of supporting individuals. It's that crisis intervention that we can put into place, and it is identifying maybe treatment options that they may have or preventative initiatives that we can put into place. That is a great way to, again, bridge that gap to letting people know that they're not alone. There's somebody out there wanting to and willing to help. So, as I mentioned, the components or parts of what we want to do is definitely look at what are some warning signs and some warning behaviors. So if you're working with a loved one or if you identify this within yourself, has there been an increase of alcohol or drug use? Again, that numbing, attempt to numb the internal concerns that you may be having, and you will be using alcohol or drug use as a way of trying to get through that. If there's an increase of aggressive behavior, that is, again, a common thing that you're feeling angry at everything and feeling that, feeling concerns. There could be withdrawal from family and friends and feeling that, no one else will understand. A dramatic mood swings that may be occurring with a loved one, seeing some changes. And again, with the withdrawal, if you see people starting to pull away from their way they used to interact with one another, is maybe a potential warning signs that they have. And then if they also identify any impulsive or reckless behavior, so definitely signs to outreach and to talk to these individuals to see how we can help. So when those are some of the signs, but if you see some of these actual behaviors, it is a critical time that we want to make sure that either there is a connections with either a therapist, a doctor, a provider, somebody to help and address these individuals, because these are, again, more alarming concerns. If an individual starts collecting or if they're saving their pills that they may be using and potentially thinking they will use it for an overdose, or maybe it's buying a weapon that they, when it out of unsure why they're suddenly buying a weapon. If they're giving away their possessions, the most loved possessions, it's a sign that maybe they are moving towards saying goodbye. Tying up any loose ends, they may be organizing their personal papers or paying off debts. Again, trying to tie up things for those that they are leaving behind, or actually them saying goodbye to friends and family, trying to prepare themselves mentally for doing that, are all signs that we definitely want to engage and be aware of so we can get them to the right help. Most of the signs that I mentioned could be adult or the adult or the youth populations. But as children, how they interact may be a little bit different. And as I mentioned earlier, the second cause of death is suicide for this population. So if you have a child or you're working with children from any capacity, if you see any symptoms, if there is a sudden change or there's a change in their baseline behavior, if they used to be always a happy-go-lucky kid and suddenly they seem upset, quite frankly, tearful a lot of times, maybe a sign something is going on that could be an underlying reason. And again, as they're trying to cope with what's going on, they may feel that hopelessness. They may have a change in their school. If they used to be great in their academics and suddenly their performance is decreasing, that could be a changes in there. Also going back to the baseline of the behaviors, not only how they interact, maybe their sleep has changed. Maybe they are sleeping a lot more than they used to or unable to sleep. There could be changes in their eating habits that they have, or if they used to be highly engaged in things such as sports, and suddenly they are no longer interested in there, is an indicator that something is going on, and definitely asking. If they become preoccupied with death, if they are starting to ask more about it, searches about it, maybe an indicator that there's some warnings that we need to have outreach to this individual. If there's feeling of hopelessness, again, when they feel that there is no hope out there, if they feel that there's no way of getting out of it. And children a lot of times will have, or a lot of individuals, they only have the focus of what's only on the here and now and not realizing kind of, that this will pass. So, if they start going through those warning signs of feeling hopelessness, if they give away their possessions for a child, some of that possessions may be the most, basic to them. So it may be a stuffed animal, or it could be their video games or book collection or whatever they, again, find the most important to them. If they start giving those away to loved ones or to others, it's definitely an opportunity to ask what's going on with them. And lastly, if there's, again, significant change in the mood, like I mentioned, if they have been from a very positive, go-lucky child to one that is upset, fearful, and crying, definitely an opportunity, or, asking them what's going on. And that's really what it is. How can we help? So we see the warning signs, we see the times when that may be impactful in there, but how can we help somebody? I think the first thing, is to ask the person if they're thinking about dying or killing themselves. I know that this conversation is a very hard one, and I have heard concerns where people have said, well, if I ask them, that's putting the thoughts in their head, and it's not. If they are upset, or that time that you have where you're actually asking them maybe the first time that they feel seen or heard, and asking that question that you care so much about them and that you want to make sure that they will continue to be here is just as important. So asking the questions, being upfront, not dancing around it is important to do. Listening. So when we start that conversation, it's taking that moment to, without judgment, without saying that, oh, you'll be fine, or no, this is just a moment, but actually truly listen to them and what they're going through, and hearing the pain that they may be experiencing will be critical to show that you care and that you're there for them, that you're being empathetic to what's going on and just being there to help support them. If that individual is, as you're talking to them, they are very upset and have even gone to beyond just thoughts about it, and said that they are truly feel that they may take harm themselves, the important thing is don't leave the person alone. It's critical to bring in some professionals into there to help. It's calling 911. It is bringing in a therapist or, like I said, 911 police officers to help with the assessments, to evaluate and allow the professionals to help that individual, get them to the right resource, to the right treatment facility to help them get through this. We definitely do not take any actions not seriously. Everything somebody says that they feel that they are going to harm themselves, we find out opportunities to remove any objects that they could use that could be a harm to them, and making sure, again, we bring them up with that National Suicide Prevention, which is a new lifeline phone number. It's a 3-digit number, 988, or, again, if they are in immediate danger, call 911 for immediate support and assistance there. And it's also not only when you're talking with the individuals, there are some great actions that we can do, and the acronym use of HOPE. I use for hopelessness, or kind of spelling it out, hopelessness is temporary. The thing that I always like to let individuals know that this pain, this employment that you're going through, this heaviness, it'll pass. May not seem like it, and it's sometimes very hard to look beyond where, again, you are going through this and feel like there is never any way out, but time does get through it. Things look different. There's I think even Patty had at the beginning of the presentation, that each day is an opportunity for a new opportunity. So each day there's a change to be able to work through this, to get through this pain. And helping individuals see that and identify that this too will pass is critical, so that they don't think that this is the only way out. O, as it's listed on here, is, again, acronyms are great. Being able to help remember is that you always have other options. There is always another way out. There is always a helping hand that is there to help get through these, and that suicide is not the solution. It will not stop. It is definitely there are other options that can get through this and that can help out. There are providers that want to and are willing and want to help you get through this. So it's finding that provider to interact with. Our primary care providers are there, definitely can help support. There are behavioral health providers, and that could be done at a face-to-face office with a a psychologist, social worker, mental health counselor, or there is options from a virtual platform that can be utilized to help get through those capacities or through those pains that are going through. They're there to help you through that, help be that supporting hand. And our last one is engage and empathize. Again, being active listeners and always letting that person know that, we are here for you. You're not alone. We are going to help you get through this and support them. It's critical. The importance is that we definitely want to stop suicide. I think a previous presentations, there were ones that we've had before, that even one has such a significant impact to all those we love. That one person who did commit suicide and died by suicide, the impact that they leave behind with the family, the guilt, the sadness that they have is so impactful. So the important thing, or what we want to have beyond anything else, is to stop suicide 100%. There are new initiatives, and again, a way that from a society standpoint is that we have moved in that direction is to create the 3-digit number. By having a national suicide prevention lifeline just went into effect in July. It has taken over a year to put that into place, but it was definitely something that as a country we found to be important as a way that individuals could call just 3 digits and being able to be connected with somebody, a counselor, who will help them through those opportunities. They're trained and willing and ready to help them to get through the sadness and getting them the help that they need. Some other opportunities that are great of helping to work or to get through these times is New Directions with our behavioral health plans has information that relates to suicide, whether it's how to ask questions, support systems that are out there, resources that are available on the internet link as indicated. Our National Alliance on Mental Illness also has information about a helpline that is available. There is My3, which is a suicide prevention app that, again, keeps individuals connected in it to help them realize that you're not alone, that you have others who are there to help support you. There's Super Better, which is a website that builds resiliency. American Foundation for Suicide Prevention, as well as there's other training opportunities, Source of Strength, which is an international youth suicide prevention program, and then our leads, the movement for our children mental health in partnership with National Children's Hospitals, are all different ways that we are trying to alert people that you're not alone. You have people who are there to help you get through these difficult times. And that includes the presentation that we have at this particular time. And definitely thank you all.
Okay. Well, thank you so much, Deb. So I'm going to invite people again, if they have questions, to feel free to put them in the Q&A box. When you were talking about, asking people, asking someone if they're thinking of hurting themselves or committing suicide, we did get a comment in the box where they said they didn't think anyone would ever admit that they were thinking about killing themselves. So I didn't know if you wanted to elaborate more on that.
Actually, majority of the time, when I have interacted in my experience as a counselor or in personal situations, most of the time people have admitted it. They have admitted that they are feeling lost, or that they are feeling so sad, or they don't know what else to do. I think within a human nature, we want to continue living. We do not want to feel this pain anymore. But again, it's that tunnel vision, or sometimes those thoughts thinking that there's no other way out, and that this is the way to do that. So finding somebody to ask that question, are you thinking of harm to yourself or others? It's that time where they're like, I have been, help me. And that's when they are coming forward and thankful that somebody has seen them and being able to ask that question. So I have actually found more than not that individuals do admit if they are having those type of thoughts.
Okay. How do you differentiate between someone who is truly suicidal and someone saying that they'll harm themselves as part of their narcissistic behavior?
For every situation, it is definitely one that you never know if they truly will or not. So I have been of the practice of that. If they are saying that, then react to it. So there may be individuals who use that as a manipulative approach of how to work with individuals or try to manipulate other loved ones. Unfortunately, there is some negative relationships where one individual will say, follow the same conversations, as a narcissist and using those. The approach, if you are the person that they were constantly saying, well, I will go ahead and kill myself, then you would say, well, I'm going to call the police, I'm going to call 911, and they're going to help you. You would not be the one that needs to try to save them, but getting them linked to the right person or the right resources who will be able to address those kind of statements. To me, it's not one that you should take lightly, and I don't. So it's definitely always linking them with somebody for an evaluation to assess if they truly need to be admitted for a hospitalization or not.
Okay, so we had a comment that someone saying that they're the mother of a child that tried to commit suicide twice in 1 year, and that she asks him this question now, and he does always answer honestly. So that's very interesting. Okay, and so sorry to hear that.
Yeah.
Okay,
But thank you
what
for
do you
asking.
think? Yes, yeah, I think that's awesome. What do you think of a parent telling their teen that they are there for them and asking the teen to make a promise that they will talk to them, their parent, before they would ever hurt themselves?
There's been a lot of, or again, kind of in my practice, is that, we would make commitments or ask people to make a contract. Again, trying to find ways to let the person know on a promissory standpoint, if you are feeling this way, I need you to come and tell me. I need you to be, and if the child or whoever is agreeable that that's, a great way to let them know no matter what, I'm always here and listening to you. The kind of, and that's a great approach. I have seen that happen. Sometimes the potential guilt, if an individual does not go and they actually can, attempt it again, it sometimes becomes a guilt concern. Is that why didn't they talk to me this time? What was different about this time? So it's not a 100% guarantee, but it's, when that individual promises you and they understand that you value them beyond anything else, I think it's a great way to try to let them know that hand is always out there for you. And please reach it anytime you want to. No questions asked.
Okay. A comment about, and I think going back to the person who asked about people with narcissistic behavior, comment came in saying, contrary to what popular media says, narcissistic people can still have a mental health crisis and be dismissed any more than others. So I just wanted to put that out there.
Unfortunately, it is, again, it's, there's no way to say, well, this one's not real or this one's not happening. I take every statement seriously. It can call it, definitely take them all seriously.
Okay. So a question, when you went through the resources, Deb, on the page, I'm just going to clip back to it, all those resources that you went through, question came in, do these resources maintain confidentiality for the person who reaches out for help? I think there is hesitation sometimes for people to reach out for fear of how asking for help could impact their livelihood if reported.
Another conflict. The only thing, and again, it actually would not matter no matter what. If you are at immediate risk for harm or, if life or anything like that, there is a duty that anybody who's on the phone, anybody who is doing that, that they would have the call 911 to come and evaluate you personally. So if you are calling somebody online and based on the conversation, there's unable to be validation that you're going to be in a safe and that you're, okay. Police officers could be called to actually come and see you at your home or anything along those lines. So that's where the only confidentiality would be changed. But any information, just like a regular therapist's office or discussions that you have, is kept confidential unless there is concern of your life, and then they will ask for others to come in and help, and again, from the calling 911, for example, to come and evaluate you.
Okay. So I just want to comment, we had a couple of people asking about the slides of the presentation. What we'll do tomorrow is we'll send the recording link out to everyone so that you can view it again, you can see the slides, you can listen again. And in the follow-up email, I'm going to take all the resources that Debbie put on here, and I'll put them in the follow-up email so you have that too.
Wonderful.
Okay. Okay. So next question, what do you do when you have an adult daughter who attempts suicide multiple times a year? She's an ex-pharmacological teacher who knows medicine, and she's never come near taking enough medicine to do any damage to herself, but we never know that. She's in her 30s, married with children. She's had several therapists and several diagnoses, but will not stay on her meds. Wow.
Yeah. Oh my goodness, that is a lot, and I'm sure that's just heavy. How can you help in your child? How do you help them, and kind of the family that they have? Every person has that self-determination, and that it is one that you would hope and that they would want to stay on the medication, but sometimes just due to their own thought practice or thought patterns, they feel they may not need it. They feel that they may not, or they may feel that they're better and therefore no longer need to take the medication. And although they're feeling better because they took the medication, it's kind of a spiral that may occur during that time. I think a capacity is to, as a parent watching them, it would probably be looking at those that are around her, so like her children, making sure they're okay, making sure that your daughter themselves, do they have that therapist? And if she is willing and open to it, making sure she has release of information, so all the different therapists, whether it's for the medication or for somebody that she's talking to, the individual or family sessions, know about each other, know the practice, so they kind of as a team can maybe help support your daughter during those times. And if they are aware or if they have seen any patterns of when these changes and when she takes medication or doesn't take medication, they again as a team can hopefully rally around her to also help support her, saying that, okay, that if there is an anniversary of something that she may not take the medication, that they're aware of it, they become mindful of it, and finding ways to hopefully help move her through that time to make sure, again, she's aware that, hey, to stay on the medication, this is how we're going to do it. And again, more of a team approach, definitely helping her through that.
Okay. What are the effects or possible risks to a child to harm themselves or attempt suicide if a close friend actually committed suicide?
Yeah, there's sadly been some in media. Sometimes I've seen that, or sometimes, in movies where it's, they see a loved one who passed away, and if this person is one that they idolized or that they thought that they knew what they could, they were the strongest person that they knew, if they couldn't handle it, how am I going to be able to handle this? Maybe one scenario that may be going through that child's mind. I think the important thing is to talk to them, asking them about them, how they are dealing with their friends who committed suicide. How are they adjusting to that? Getting a therapist to talk and walking through that grief. Like I said, they may be not understanding and the guilt in some capacities, anger. That's a common reaction also to grief. of losing someone that they've idolized, if they feel that, again, that if they couldn't handle it, how am I going to be able to do that, is more of an important time to maybe increase them seeing a therapist, helping with coping mechanisms, finding ways to help them through that spiral they feel like they're going to be going down, or some potential opportunities to help them.
Okay. And someone's asking which task force mentioned is working to address the bullying that comes via social media. That seems to be a top contributing factor for our youth.
I don't know the task force themselves. I know that different schools, high schools, grade schools, they have themselves created different initiatives that they put into place at the different schools of how to address bullying if they're aware of them from that capacity. But unfortunately, I do not know the name of the task force that is completing that. I'd have to follow up on that.
Okay.
But I think it's great. I think the social media impact on our children is obviously, my generation was not it. We didn't have any of that. So it's a different, during those teenage years, kind of your peer influence, your peer view of how your friends or what your friends look like, what do they think about you, and trying to fit within the norm of that group is critical during that time frame. And having that societal input of if it's Instagram, how many likes do I have? How many, do I have friends follow me on this site? Becomes critical. And I think finding ways to right-size that as the parent is something that I've done kind of on a more individual level, talking to my children about it, telling them about the societal world outside of social media, trying to normalize it from that perspective, maybe on an individual standpoint, how I've been able to working or trying to help my kids through it.
Okay. When an employee receives mental health counseling, does anyone at the employee's company know that information from the insurance company, or is this information always confidential?
Again, like I mentioned, from an employee standpoint, no. There's employee assistance programs. Most of those are potentially offered by the employer themselves. So being notified that somebody may be utilizing EAP services, there's traditionally not a name associated with it. What you're discussing with that therapist is also not discoverable. It's confidential. If you are seeing somebody for psychotherapeutic interactions, again, if you're going through depression, anxiety, and your interactions, again, with that therapist is not discoverable by your employer, that, again, it's a confidential component of that and it's kept between you and your therapist. Except for those situations, like I said, if there is concern of harm to yourself, that your life is in danger or in jeopardy, that 911 is notified from that side, but not the employer.
Yeah. So I didn't see this listed in the warning signs presented, but would stuff collected by a loved one just piled on top of each other on a couch, for example, be considered a warning sign of underlying depression and anxiety? I know some people call it hoarding. I'm sure that collecting could be a sign of a messy mind or mental paralysis of some sort. It seems to be the opposite of OCD. How would I help this person organize their stuff and keep those that spark joy? This person has a therapist.
Yeah, and just like you said, or kind of as I mentioned, not one event can automatically say, okay, well, this person is suicidal. There could be multiple reasons. Just like you said, by piling up on a corner of a bed or a chair or something, could be hoarding. It could be that they just are distracted and unable to focus. It could be physically, they may not be able to move the items from the area. There may not even be a mental capacity. I think the main thing with anytime you see something that doesn't seem like their normal behavior, ask them, I see that you've got all these items over here on the couch. why are they still there? Why are they there? Why do you, and see what they're responding to. I have found open-ended questions is a great way of building that conversation. Don't automatically assume. It'd be like, why are all these here? Instead of, are you keeping them there because you're hoarding? Are two different ways of approaching maybe the same topic by just asking them, why do you have them here? And just pausing and allowing them to answer. You'll be surprised at some of the responses that you'll get.
Okay. Are these resources and sites something we can comfortably send to our teams to alone? If my teen has a mental health / suicide situation, I'd love for him to come to me, but if he's not comfortable, I'd rather he get assistance by any means available.
Yeah, especially that last slide, I think that had everything from, on the national line number is, available. The information like New Direction, again, is a website that can be viewable at the discretion of your own computer, at your own desk to understand maybe some questions, some warning signs that you have out there. All of that is available for anybody to utilize.
Okay. What kind of services are offered for our first responders? What would you recommend without it jeopardizing their job? Who could they speak to about the trauma they see on a daily basis?
Oh, great question. Yeah, and I know that, for example, like even those who address on the suicide hotline phone calls, obviously those are very emotionally impactful, that you're on this call and kind of holding someone's life in your hands during that time because you're trying to convince and talk them through one of their deep, hopeless feelings that they are having. So I know a lot of those organizations that they have, like the suicide hotlines, they will have after you have such a call, they will go through a room of just to decompress, being able to work through that because, one call after another, you're just, going through those raw experiences during that time. There is also, so there's ways of doing that from just an individual kind of stepping back from it. There are EAP programs. I'm not sure of all of the ones for the first responders, so I'm sure they have those exact same things where they are able to help those individuals who have gone through those traumatic events. When I've worked at other agencies, we used to provide that if there was something really that significant that is out there to help individuals talk about it. I think kind of globally what we've seen, if you keep those feelings in and you keep them bottled up, they fester and become more. And the best way of getting through that is to talking to somebody about it, whether it's other peers, those who have gone through the exact same event that you have, can help build that support that, we're not alone. If it's talking to a therapist, a provider is another great way of, somebody who can help you see on that other side is important to go through that as well.
Okay. Someone mentioned maybe use the Baker Act as a context for intervention, and I was wondering if you could explain to everyone what the Baker Act is.
Yeah, the Baker Act is a law in Florida that indicates that if a person is at risk for harm to themselves, harm to others, and that harm could be a potential suicide attempt or suicide act, it could be that they are unable to care for themselves. So due to their psychotic mental status, they're not able to care for themselves due to, they're not eating, they're putting themselves in dangerous situations. A first responder or a police officer, a therapist such as myself, can place what we call a Baker Act in relation to an individual, so that person is involuntarily sent to a hospital, and at least for 3 days they are being evaluated and being treated by psychiatrists or at that hospital setting to hopefully address those behaviors. It could be needing to implement medication. If a person has had their medication and they stop, there could be a decompensation in the medication. That 3 days will hopefully be able to stabilize them. Also, if they are going through severe depression, have never been on medication, it could be the opposite, where they actually introduce medication to that individual to hopefully, help them from a chemical standpoint, being able to evaluate and see things in a different light. There's therapeutic capacities where they have group sessions that occur at the hospital during that time. And those Baker Act, again, is a 3-day involuntary admission. After 3 days, if it is clinically appropriate, the patient can volunteer to stay at that hospital for continuing treatment, or if the intervention that was provided seemed to be able to assist that member to get through those indications, they'll be discharged from the hospital during that time. So
okay.
that is.
So, Debbie, do other states have the Baker Act? Does it vary state to state?
It's called different things. We just call it Baker Act here in Florida. So, yes, there is an involuntary type law or stipulations that are placed in there. The requirements for it may be slightly different, or it could be how long that they are at the facility. I know, again, normally it's 3 days seems to be a good way of kind of helping somebody through those times.
Okay. I have a 40-year-old ex-Marine, it's my son, that has attempted suicide 5 times. He lost his wife 2 years ago and has 2 kids. They were living with the wife's dad in rural Georgia, and he's now living with me in Florida. What can I do to grow his self-worth and self-value? He also suffers from PTSD. He's under the care of a psychiatrist at the VA, but how can I help him develop these traits?
Wow, that's a lot. I'm sorry for him and all. He's lost not only from the impact of being, I'm assuming, when he was in theater or in the military, and then also his loved one as well. I know with the VA or with individuals who have previously been active duty is that they do have a lot of support systems as well. So based on where he lives, there is those opportunities, maybe some peer supports. I've found when I have worked with military members that, the ones they feel can only understand are those who have gone through similar things. So I have heard of great success in looking towards the buddy system. I think it's one group that I've heard, or different peer support where they can help each other. And I think helping or making sure he has a good support system is one way of helping. It sounds like he does have a lot of great resources with the therapists and other groups, but sometimes it's continuing to build that support, checking up on him. It may seem repetitive, but, or how are you doing, and, what can we do to help support? And if you see some certain, again, anniversaries that may trigger this close to the death of his wife, maybe times to make sure he's doing and finding things to maybe acknowledge her death and, celebrating her life that she, left behind, and doing positive things during that time to give him things to look forward to, and giving him some positive interactions from that side, maybe a few things that could be done.
Okay, and someone did comment that I believe you can go to the military one source website. They have tools for help for loved ones and civilians. Okay. Another question, if you have to call 911 for someone, should you tell that person that you did that, or just wait with them for help to arrive?
I tell them, and I think it's just more of I'm not, not hiding anything. I usually am very upfront with individuals when I've had that individual on the phone with me, and I said, I value your life and your safety. I am not, and I want to get you into the right hands who can do that. So I have called emergency personnel. They're going to be coming out here and evaluating where things can go next, just because I care about you that much, that I want to make sure that you get into the right group, right professionals to help with that. I have had people become very upset about that. They have felt everything from, why are you calling them? You don't need to call them. And they feel sometimes I don't want to say ashamed, but they don't like the attention when, the ambulance service or the police services is coming up into their neighborhood or wherever they're at. So they may become angry during that time, but I have said, I want to make sure you're okay. I know you're mad with me, but I want to make sure that you're all right.
Okay. We got asked for more detail about that term that you used of mental paralysis and how or if it can affect a person's ability to manage their own suicidal ideation, and whether it's possible that that's something that's a warning sign. Person said, this is the first time I've heard that term, but she's thinking it refers to the inability to say something because it's too much, even if it's something small. And she's wondering if this is a sign that she wasn't aware of.
Did I say mental paralysis? I don't know if
I think it was part of a question. It was part of a question with the hoarding. And, when someone was talking about if someone's putting stuff on a couch and maybe it's hoarding, or maybe they're feeling like they have mental paralysis, they can't deal with things.
Yeah. I mean, there's, if I think about it from that lens or that perspective, sometimes things become more overwhelming. Personally, I've dealt with that. When you are dealing with so much stress, like I just can't deal with that right now. And it could be everything like I cannot even look at the laundry right now. I just cannot address that. And as a way of a coping mechanism, you will kind of block that and I'm not going to focus on it. It can be a resiliency standpoint where you're able to say, okay, I just can't focus on it right now, but I eventually will. That's fine. It's when you completely block it and it does not, and you never go back to it, that it becomes concerning. If you feel that it's, or you ignore it too long, I think is where some of the concerns would be. So anytime, I don't know if that would be necessarily a warning, but it could lead to or be similar in that context, that if their previous behavior was they always had a house that was kept, they were always able to eat, they cooked their own food and everything. And then if you shift and you see them now and their house does not seem like the way it used to be, they seem maybe so overwhelmed, they're no longer eating like they used to be. Again, that could be a sign that something underlying is occurring and they're trying to only do with what they can. So that may be a sign of it.
Okay. Do the police also respond to a 911 call for the Baker Act?
They do. And that is sometimes due, and there has been some changes. I know in some counties, for example, down in Hillsborough County in Tampa, they have initiated some new protocols where it would be a police officer or team that has going out there due to, unfortunately, sometimes individuals, if they are in a psychotic situation, they may be dangerous from that side. So they do have police officers there from a protection standpoint. But as I was mentioning down in Hillsborough, they have not only the police officers, but they also have a mental health counselor with them at that same time. So then as a collective team, the officers will be able to help from if there is any danger that is at that time, but the mental health counselor as well will hopefully be able to see the concerns that the patient has and maybe hopefully talk them through to get them to, hey, let's go to the hospital. It seems that it's, you're going through a lot right now, and hopefully walk them through on a more successful way of getting them to the right care. But yes, calling 911, mentioning that somebody is at risk of harm to themselves, the police is called during that time.
Okay. And someone just put in, should we, I think they mean, should we confront employees if they have issues?
As an employee, for any person, I think when you have the concerns that somebody's going through a lot, I think as a way of asking, saying, and they may not be wanting to tell you, but I think what I have found is that if you see somebody and say, and you have that relationship with them, if you talk to John Smith, your employee, and say, I've been seeing that you've been not how you normally are. I want to make sure that you're okay. If you don't want to talk to me about it, that's fine. But please know you have these resources, and it could be providing them everything from EAP, if that's an opportunity that's currently at your organization, and they can talk to somebody about those changes, or calling 988, calling the suicide, services. I think we're, as individuals, as humans, that we need to be helping each other any way we can, and for our employees especially, or for everybody actually. If you see somebody and you notice that they're not how they normally are, telling them that I see you, I see you're going through something, and here's something that it can help you is what we should be doing.
Okay. Someone's saying, is it the same for 988? And I'm not sure if that's related to asking about the Baker Act or not. So I don't know if you want to put in a little bit more clarification, but maybe you could answer that. Yeah. So asking with the Baker Act. Mm-hmm.
So yes, 988 is a national number, so it would be no matter where in the United States, and is that central number. The locations or who answer the calls, I do believe that they try to make it local so that they are aware of any legal ramifications, such as the Baker Act, is mindful of it. But again, like even when I was addressing any suicidal calls that I would have, it would be calling a general number, and then we would connect with the local services or and law enforcement agencies in that person's town. That's why I'm sure that they do that over there, as they get the address of where somebody is at that time of their call, so that if law enforcement needs to be sent out, they know where to find the individuals and being able to connect them with the right care.
Okay. I want to read this. It's not a question, but someone wrote, I've been affected by suicide closely as a teen with friends who have been successful in their attempts, to myself having thoughts, to my nephew who seemed to have everything going for him, was a star baseball player with a scholarship who was successful in his suicide attempts as well. It can affect anyone, and it's no respecter of people. I'm doing well, and I see a positive light most days and never take for granted the opportunity to reach out if I'm not doing well. Help is here. Use it always. You can save lives, if only one. Oh, very powerful.
Very powerful, absolutely.
Okay, so anyway, we are getting close to the end of time. Well, thank you very much for telling us that. Very powerful statement. So I do want to ask people if they could, we've got a 4-question evaluation. If you have a minute to fill that out, you can also point your smartphone camera at the QR code. We've got a couple of handouts, and tomorrow I'll get everyone the recording link, the follow-up resources that Debbie mentioned, and the handouts that are here. And also did want to tell everyone that with our Sanitas partner, we have a women's health webinar next month, and then Debbie will be back with us in November for mental well-being for caregivers. So if you're interested in that, go ahead and register. I'll give you guys the links tomorrow too. And Debbie, thank you so much for all of the knowledge that you shared and the resources that you shared with us today. I wanted to thank everyone for joining us. And I'll keep this up for a minute in case, we have one more little question, not a small question that came in. How can you help parents that lost a child by suicide?
Wow. Yeah, I know. So hard. I think, for any parent, obviously, or anybody that's impacted by suicide, it is a definite grief or impact that they will be going through. They will see feelings of guilt. What did I miss? What did I not see? And supporting them through that time, very similar to what we talked about before, asking, are they okay? Around the anniversary, if it's the birthday, Mother's Day, Father's Day, Christmas, holidays, whatever those times, taking the time to ask them. And then those, middle of the day, Tuesday, asking if they're okay, following up with them, being that supports them. listening to them empathetically, asking them. I think a lot of times we avoid death and conversations around death, so they maybe not feel that they can talk about their loved one and or the shame of, that they committed suicide, or they feel that shame of it, that they did something. I think it's just being empathetic and being helpful to let them know, no matter what, you're your friend, you're there to help support them through this.
Okay. Okay. Well, if any questions came in that we missed, we'll see if we can answer them in the follow-up email. So thank you everyone for joining us, and have a wonderful rest of your day.